Residents in East Palestine are concerned that rashes, headaches, and other symptoms may be linked to chemicals from a train crash. Some East Palestine, Ohio, residents claim they have developed rashes, sore throats, nausea, and headaches since returning home this week, and they are concerned that these new symptoms are related to chemicals released after a train derailment 2 weeks ago. The February 3 incident resulted in a massive fire, prompting officials to evacuate hundreds of people living nearby due to concerns that a hazardous, highly flammable material would ignite. To avoid a potentially fatal explosion, toxic vinyl chloride gas was vented and burned, creating a plume of black smoke that hung over the town for days. According to the U.S. Environmental Protection Agency, other chemicals of concern at the site include phosgene and hydrogen chloride, which are released when vinyl chloride degrades, butyl acrylate, ethylene glycol monobutyl ether acetate, and 2-ethylhexyl acrylate. All of these chemicals can change when they degrade or react with other substances in the environment, resulting in a toxic stew. Residents were given the green light to return home on February 8 after air monitoring in East Palestine revealed no elevated chemicals of concern. According to officials, additional testing of indoor air in approximately 500 homes revealed no hazards. Although officials are still testing water from rivers, streams, and residential wells in the area, tests of tap water from the municipal system revealed no chemicals at levels that would pose a health risk. These test results have failed to reassure some residents, who claim something is making them sick despite officials' inability to locate it. "I can't put my family's health at risk. When we returned on the 10th, that's when we realized we couldn't raise our children here," Amanda Greathouse explained. "There was a foul odor that reminded me of hair-perming solution." Greathouse said she had been back in their house for about 30 minutes when she developed a rash and nausea. "I had a rash on my skin on my arm when we left, and my eyes were burning for a few days after that," said Greathouse, a mother of 2 preschool-aged children. Since the derailment, she and her husband have only returned to their home twice to pick up paperwork and clothing. "The chemical smell was so strong it made me sick," Greathouse said. "I just wanted to quickly pick up what I needed and leave. I only brought a few pieces of clothing because the clothes themselves smelled like chemicals, and I'm afraid to put them on my children." She also claims that since the derailment, she has kept her children out of preschool. Despite her son's teacher's assurance that students will only drink bottled water, she is concerned about other types of contamination. "I don't want to take my son out of the preschool there, and because I really like the teachers he has, but I'm still scared. Some teachers have even expressed concern about the air quality," said Greathouse. "We are extremely fortunate to rent our home. I never thought I'd say that. I pity my landlord, but I simply cannot risk my family's health." Ohio Governor Mike DeWine said a request for medical experts from the U.S. Department of Health and Human Services was granted, and officials should arrive early next week to help support a patient clinic. "We know that science indicates that this water and air are safe. However, we recognize that residents of East Palestine are understandably concerned," he said on Friday. DeWine stated that he intends to open a clinic where HHS officials and others will answer questions, assess symptoms, and provide medical advice. According to a CDC spokesperson who asked not to be identified because they weren't authorized to share the details, the Agency for Toxic Substances and Disease Registry, which is part of the U.S. Centers for Disease Control and Prevention, expects to have a team on site Monday. The team will conduct an assessment of chemical exposure investigation, which will look into how a chemical release affects people and the community. The volatile organic compounds released by the controlled explosion may cause symptoms similar to those reported by some East Palestine residents, such as headache, sore throat, nose and eye irritation, but experts say it is extremely difficult to link chemical exposure to health effects. "That is a significant challenge," says Aaron Haynes, chair of the University of Kentucky's Department of Epidemiology and Environmental Health. "The community is now exposed to a mixture of numerous petroleum-based volatile organic compounds, so it could be a combination of them," Haynes explained. Haynes, who has investigated toxic exposures in communities, says she is requesting permission from her university's Institutional Review Board to begin a study in East Palestine to help residents learn more about their chemical exposures in the air, water, and soil. They need all the assistance they can get, she explained. This is a major crisis. This is a major catastrophe. They require all of the assistance that we can muster. The rashes could very well be evidence of a toxic exposure, she said. Looking for solutions. Audrey DeSanzo is looking for answers as well. How safe is it really? Asked DeSanzo, who lives about a half-mile away with her 2 grade school-aged children. It's not in all these people's heads that they're getting rashes, conjunctivitis, pink eye from chemicals. You have a sore throat while you're here, it stinks out here. Following the derailment, DeSanzo and her children fled to Pennsylvania, where her uncle had an empty duplex. They slept on the couch and the floor. DeSanzo claims that when she returned home this week, she aired out her house, changed the furnace filter, and washed their sheets and clothes. Nonetheless, she claims that they recently went to a local urgent care clinic because her children were coughing and our throats were raw. Strep throat tests came back negative. The doctor gave the kids cough medicine and told DeSanzo that the chemicals were most likely to blame. According to DeSanzo, the doctor told her that she had seen a number of East Palestine residents with similar symptoms and advised them to call poison control and go to the local hospital for a blood test. She has not yet received the blood test. Debbie Peterzak, a spokesperson for Salem Regional Medical Center, which operates the clinic DeSanzo visited, confirmed that the clinic has treated a small number of residents suffering from symptoms such as sore throats and respiratory problems. According to her, the hospital's emergency room has seen fewer than 10 patients from East Palestine. Our facilities and primary care providers are ready to assist anyone seeking medical attention, and we are collaborating with the county's health department and other local, state, and federal agencies that are monitoring the situation, Peterzak said in an email. East Palestine residents are also calling the state's poison control centers, according to Natalie Ryan, a pharmacist who directs the Central Ohio Poison Center. Toxicology experts who staff the helplines can assist if chemicals are a health concern. DeSanzo claims she wishes she could leave but cannot afford to. Her monthly mortgage is around $400, which is less than half the price of other homes in the area that are closer to the accident site. I earn $14 per hour. How should I proceed? She stated. I don't want to be here with my kids right now. Despite assurances, residents say they will not return. Since April, Ayla and Tyler Antoniazzi and their 2 daughters have been living in East Palestine. Ayla says they weren't sure about moving out after the train wreck, but they're now thinking about it. The Antoniazzis returned to their home less than a mile away the day after the evacuation order was lifted. Before I brought my kids home, I washed all the linen and a bunch of clothes, cleaned the surfaces, and aired out the house, Ayla explained. However, when they awoke the next day, they weren't themselves. My eldest was covered in a rash on her face. The youngest did as well, but not as badly. The 2-year-old was holding her eye and complaining that it hurt. She was drowsy, so I drove them back to my parents' house. Ayla reports that her daughters are staying with her parents in Latonia, about 20 minutes west of East Palestine, until the couple can ensure the safety of their home. The children's symptoms improved in Latonia, she said, but one of them developed a new rash when she returned to school in East Palestine on February 13. I did allow my 4-year-old to return to preschool at East Palestine Elementary School. She returned for 2 days and developed another rash on her hands and began complaining of itching, so I drew her back out, Ayla explained. According to Ayla, she has scheduled a medical appointment with her daughters for next week to discuss their symptoms and testing options. According to Dr. Carrie Nadeau, an allergist and chair of the Department of Environmental Health at Harvard's T.H. Chan School of Public Health, this is the right thing to do. Rashes, sore throats, and headaches, according to Nadeau, can be clinical signs of chemical sensitivity. There are people who are extremely sensitive to chemicals and can detect them before a monitor can, Nadeau explained. There is no good diagnostic pathway for chemical sensitivities. Much of it is based on clinical symptoms, such as rashes. Nadeau and other environmental health experts advise people experiencing symptoms to see a doctor, primarily for medical care but also to have their case documented. So that if there is a cluster, or if there is a group of people who have all of a sudden complained about a rash or given symptoms, that really helps doctors collaborate with institutions like the CDC and do a little bit more fact-finding, she explained.